Hello again, everybody. This is Fred Kranz from St. Ange coming to you today with another episode of Taking the Supply Chain Pulse. Today we're blessed to have with us Dennis Mullins, who is the Enterprise Vice President of Supply Chain Operations for Advocate Health. That's a mouthful of a title. Dennis, thanks for joining us.
Thank you for having me, Fred.
I know it's a Friday afternoon and it's late, so I appreciate your time. Why don't you tell us about yourself and your background? How did you get to where you are today?
Oh man, that's a long story, but we're going to try to cover it in a short amount of time. But at the end of the day, I've been doing healthcare supply chain since I was about a 20-year-old kid. I started off in the Air Force doing medical supplies, and oddly enough, it was a career field that chose me, not that I chose. I chose the Air Force, but I went in kind of an open category, open general category. So medical material was chosen for me. Didn't have a clue what that meant, what it was, but over the course of close to an 11-year career in the Air Force doing medical supply around the world, I grew to be what I thought good at it. I was early on in my career, I was the data guy. And I think that going down that path is really what opened my eyes. And oddly enough, it was a sports injury that got me down that path because I started off just working in the warehouse doing, just kind of distribution, receiving, and filling parts and that kind of stuff. But I broke my ankle and had to have reconstructive surgery on my ankle, which meant I couldn't do that type of work. And they put me on the administrative side doing the IT work. Back then we ran end of day systems and end of month, but that gave me an opportunity to kind of look behind the curtain in supply chain and really understand how the different domains and lanes of supply chain intersected. And that's when I became the data guy and really kind of grew a love for it. But after 11 years in the Air Force and when I got out, because I became a single dad with my lovely daughter, I went back home to South Carolina and started working for what was Columbia HCA at the time, and through that experience was allowed an opportunity to be involved in the early beginnings of their consolidated service center model back in the mid 90s, and spent about 8 years working for HCA in different divisions, different roles for them, either as a contracting director of the division or facility supply chain director, and then also a market operations director in the Far West division. I left the for-profit side and started working on the academic health side and joined University of Florida for a number of years before being recruited to Baylor Healthcare System, and was part of their merger with Scott and White. But then I got recruited to Indiana University Health, so continuing down this path of academic health. Ran Indiana University Health Supply Chain as their senior VP of supply chain for about 7 years before joining Advocate via the Atrium Health and now Advocate Aurora merger. So long story short, about 37 years of doing this, a blend of government medical supplies, for-profit, and academic health, not-for-profit. So I think that I've got a good diverse background and seen a lot of different things in this industry, but have enjoyed it. It's part of who I am. I like to say it's part of my DNA.
Very good. You said you spent about 11 years in the Air Force, and I would joke with you and say prior to that you were in the real military because you were a Marine, right?
I was a Marine reservist for a couple of years. Actually drove tanks and went through Parris Island basic training and Fort Knox, Kentucky for tank training. But I had a wise older brother who was an active duty Marine, and when I was thinking about active duty, he told me to make sure I chose a career field that had a job that I could use on the outside. Nobody was driving tanks, so hence the reason I joined the Air Force. And my brother was right, because what I learned in the Air Force is what I do today.
Well, your brother was also right in the last thing anyone should ever want to be is a grunt. I was a grunt corpsman, so I had to go on patrols with those guys, and when someone shot them, I had to go and get them, and that's a lot tougher than the Air Force. But let's talk about that. You spent 11 years in the military, and since then you've often served in ops roles that require a deep knowledge about transportation and logistics. How did your military experience help you to be prepared for the roles you've had since?
You know, I think more than anything, probably the discipline to show up every day and execute the mission is what I probably lean more on from a military background perspective. As you know, being a veteran yourself, they kind of they strip everybody down to kind of the core because you think about basic training, and I went through two of them, going through Marine Corps and Air Force basic training. So I had an opportunity to kind of see, all of the different walks of life that join the military. You've got the jock, you've got the nerd, you got the privileged kids, you got the kid that's coming out of like a rough life, um, and through basic training they kind of strip you down, and then they teach you how to move as a team, and you execute the mission, and nothing trumps the mission, and you support the mission. So I think that work ethic and that mindset has really helped me in the civilian sector in terms of how I approach what I do on a daily basis and being a so um, I'm proud of that. I've had the opportunity to work with a lot of military folks that have separated from the military either through retirement or they got out like I did. And we all kind of share the same mindset in terms of this is the mission, this is how we execute and how we move as one.
Yeah, that's interesting. I'll get off this after this statement, but the one thing that I remember from being in Vietnam, and like I say, I was a grunt corpsman, so I was with 3rd Battalion, 3rd Marines, which was infantry. Whenever you got
Mhm,
in a firefight, you were never scared in a firefight because you were
mhm.
trained so well that you were doing what you said. I mean, the term execute the mission. People knew their roles, they did what they're supposed to do. If you were getting incoming from mortar or artillery, you're scared to death because that stuff was indiscriminate and you couldn't do anything about it. But the discipline to execute the mission, I think, is a beautiful thing that you bring up. Now, I've known you since your days at Baylor Scott and White, and before that, you had key positions, as you said, at HCA and UHF. And since we met, you've taken on progressively more important roles at other organizations like Indiana University Health and now at Advocate. Once again, what are the similarities among those roles, and what did you take from each of them to your next position?
Wow. I mean, the similarity is really the customer. The customer at hand obviously is the patient, and that connect to purpose, being the patient, I think holds true if you're going to do the job well, anywhere you go. And I can remember distinctly early in my Air Force career when I had that connect to purpose and realized the importance of what I do and what healthcare supply chain leaders do on a daily basis. I mean, it was something as simple as someone calling and needing a particular product, and I went and picked the product and I get to the unit to deliver it, and it happened to be something that they needed for a code card, and the patient was coding at the time. Um, and they just snatched it out of my hand, opened it, and started using it. And just like the light came on how critical uh, that was, and how important it was that we do our jobs. And I've held on to that throughout my entire career, just remembering that instance of that connected purpose. And I've had to kind of basically recite that story many times in my career with my staff because as supply chain and healthcare has evolved in the last 20 years or so, we've gone from the whole centralized supply chain where you had a director of materials management inside the hospital and they wore all the hats as it relates to supply chain to now a more decentralized, it was a decentralized where you were in the hospitals, and now it's gone to a centralized model because now you have these large IDNs, you got multiple hospitals, like we have 67 in 6 states, but we have one procurement department. So um, that evolution of supply chain over the last 20 years has really made me step back and make sure that I understood how what I did impacted the different areas within supply chain. So um, I think having that connected purpose when we're now in this centralized environment, and even now post COVID, where a lot of folks, such as myself, are remote. So you're not even in the halls or the hallways often of the hospitals, oftentimes, to be able to see uh, the patients or the physicians or the clinicians. So it's hard to visualize it. So that's the reason why I tell that story often, to remind folks, because we got a lot of folks that work in the administrative portions of supply chain that have never worked inside of a hospital and don't really truly understand its impact. We have to remind them of that. And I think that that's the similarity that I see from organization to organization that I've gone. There may be a different organization, different systems, but you never forget about who's truly the customer, and that's those patients that we're serving our communities.
Do you think some of those folks that have never worked in a hospital or never been in the environment, do you think that that hurts their ability to perform, or do you think they they acquire an understanding as they go along?
I wouldn't go so far as to say that it hurts their ability to perform, um, but I think incumbent upon us as leaders to make sure that we bring awareness to them. Um, I do think that there's a lot of value in bringing folks in from outside of industry because they bring different and fresh ideas on how things are done from a supply chain perspective. But we also have to make sure that they understand there's a difference between pulling supplies for cars versus pulling, a vital medical device that may be life saving, such as my experience when I delivered that critical supply for someone that was coding. So I think it's incumbent upon us to make sure that they're aware of that. And then, once they're aware of that, and I like to, make sure that, my folks that are remote or in an administrative function have an opportunity to kind of work in a hospital and shadow those folks so they can see that their peers that may be working in receiving or delivering supplies in PAR or working in a procedural area like a cath lab or an OR, that they can go spend a few days in there and actually do the work, not just watch, but actually see the finished product of the contract that you negotiated or the purchase order that you cut or the item master that you built, so you can see that connect to your purpose.
Yep, that's very important. I always used to, I'm one of those guys that came from the system where it was centralized in one spot, like you said, an acute care hospital. And I
Mhm.
not only knew where the products were going to, I knew who was going to open them up when they got there and what they're going to do with them. And that I always thought that gave you a level of understanding and maybe empathy that the folks that work remotely may not get to understand, and
Mhm.
it's a shame. But IDNs like yours continue to grow. I mean, your current IDN advocate is the result of some mergers, and and you could go to work Monday and find out that over the weekend your system acquired three more hospitals, so that you now have 70 hospitals in 7 states instead of
Mhm.
67 and six. Do you have any kind of what I would call a resiliency plan ready to bring new institutions on board? I mean, it's got to be difficult to handle that constant change.
Um, yeah, I mean, we've got a couple of different mergers and acquisitions that are happening right now. Not necessarily whole hospitals, but we've got physician practices that we bring on board, uh, uh, ambulatory surgery centers as well, and we've got a playbook essentially that again crosses all those different domains within supply chain. Whether it be making sure that, I mean, the first step is contractually. I mean, are they utilizing uh, and rostered appropriately on our existing agreements so that they can maximize their pricing? Then we start looking at what systems are they using? How are they actually acquiring products and services? We're looking at operationally how are they moving products throughout their system. Um, you know, Even purchase services, something as simple as security or elevator maintenance, all of that stuff's important. So, we've got a documented integration plan that has kind of the major things that you need to be looking at and looking for synergies or harmonization, whatever you want to call it. But obviously, you have to allow some room for some flexibility because every situation is a little bit different. But in large part, I think we cover all bases with the plans that we have.
Oh, you got to have a plan. I don't know how I don't really know how you guys can do it because the geography is like an amoeba. It's changing every day, everywhere. It's tough. But
Absolutely.
you're one of the first. You're probably one of the only people I know that has designed and built a consolidated services center, Indiana University, from the ground up,
Mhm.
from conception to opening the doors and making it work. Tell us about that and how you assembled a team to get that done.
Well, you and I talk sports often, Fred, so I kind of keep it there. And when I got recruited to IU Health, uh, our CEO, well, he was the COO at the time. Dennis Murphy is now the CEO of that company, but he kind of gave me the green light to basically build what I felt like we needed. And, I felt like as I began looking for the right folks to support the organization, I, I, I didn't want kind of that proven kind of head coach. I didn't want the Bill Belichick's of the world. Give me that what's that the next up and coming assistant coach. So those are the types of folks that I actually went and got that were as competitive as I am because we often said we like to win. And we set a goal to become one of Gartner's top 25 healthcare supply chains, which we were able to accomplish after several years. But um, I assembled that team of folks, and as I think the mark of a good leader is can you grow them right where they're at, and really just understanding and being self-aware enough to understand, you know, where are my strengths and where are my weaknesses. Even though I was the senior executive on that team, there may be someone like, and I'll mention names. Derek Williams was my logistics leader. He's stronger in logistics than I am. Or had Frito Pagan, who was over on the data side. And he's stronger in that space than I am. Uh, but I provided the strategic direction for that initiative, and I had strong players that were aggressive in the right way, and we put together that plan and we executed, and had a lot of fun doing it. I think that was a major part of it. It was just a lot of fun. And I had Cumbia Lewis, who was running hospital operations, and we trusted each other. We worked hard. We had fun. We had a strong plan. We certainly respected the accomplishments of other healthcare systems, which is why we went to see what I like to call the usual suspects. We went to Lisa. We went to Intermountain Health. We went to see an HCA distribution center. Uh, we saw all of the usual suspects to see what good looked like. And plus, we utilized our own experience, and we basically coalesced all that information, all those experiences, and we put together our own plan. Um, and we wanted more automation than what we had seen, which was why we engaged Swisslog and was able to put the first distribution center on the provider side that had that type of automation. And it's thriving to this day. So proud of that accomplishment. Had the most fun in my career in those 7 years that I was there with that team, and we did some great things.
Yeah, the other thing that I think was interesting because I visited you, I believe, before you opened the place.
Mhm.
I was there as you were still building it. And what I thought was really unique and interesting was you had this completely new place away from other stuff. You were able to do it without having the regular work going on in your space while you were doing it. You got to really design it. You got to figure out where you were going to put the different functions, how much space you were going to have for each thing that was
Mhm.
going in there without having to fall over people who were doing the work already in the same geography.
Yeah, I mean that was a plus. I mean, I will say, and I don't want to oversimplify it. It wasn't easy to keep the lights on and do the work while we were building a new house, because we still had to make sure products were ending up on the in the hospitals. But having that open space to be able to do it, we used a lot of lean methodologies and practices to really to really fine tune the plan. So like we use a 3P um, process to kind of lay out the distribution flow. We're using cardboard. This is where the auto store is going to be. This is where the pick and pass area is going to be. And we already had our material handling equipment, and we were doing test flows just to make sure that things were positioned the right way. And I remember we had to actually move the auto store just a few feet to the right because we felt like there wasn't enough turn ratio for a forklift to load the flow racks from the back side there, and we wanted it to be safe. So, and we did test runs over and over and over again before we delivered the first product because everybody needed to know. And I think that also ties to the military experience, not only for me, but I mentioned Derek Williams, who was over logistics. He's a retired Army logistics officer. We train like the military. Like, military has war readiness training, and we were running dry runs over and over and over and over again. So when we got that first order, everybody knew where they were supposed to be and how it was supposed to work. And not that we got it perfect right out the gate, because certainly there were still kinks in the whole system, and we had to, optimize it. But we were able to bring on 17 hospitals in 6 months without any major disruptions whatsoever.
So in effect, the first day wasn't really the first day. You'd already been doing it and with
Yes,
planning.
sir.
Great. So you just authored and published a new book called Leadership Mastery: Unlock Your Full Potential and Lead with Impact. Tell us about
hmm
that book and what prompted you to write it.
Well, I've had the opportunity to work for and with some really great leaders over the course of my 30 plus years in it. And I've seen great examples of how to do it right, but I've also seen and made some mistakes myself as a leader. And I thought, it made sense for me because I'm a note taker, and I would jot down, best practices that I saw. And so let's take the opportunity to kind of put this in writing. And my time between IU Health and Advocate, I had some free time there to kind of just put the stuff on paper. And then recently, just decided to kind of pick it up and dust it off and put it out there. But really, my goal behind this really is to make sure that uh, I shared with the leaders that are coming up behind me kind of the tool book or the playbook, I should say, on how to lead the right way. And I mean, we talk a lot about just understanding yourself as a leader, how to work through challenges in a business setting, talk about the strategic part of being a leader and how to think and your decision making abilities, making sure that you've got um, the right steps in place to be able to build a high performing team. Um, and then at the end of the book, we've got some training exercises. I talked about training for the service center. Uh, the book has some good ideas on how to do things, but on the back of it, you've got areas that if you wanted to go through this with your team, you could actually in these scenarios to kind of do some test runs. One of the things as an Air Force guy, when I became a non-commissioned officer, you couldn't become an NCO without going through what we call Airman Leadership School. You didn't just move up in the ranks; you had to actually be trained on leadership, and that
Right.
that is another reason why I thought about this. Is like uh, there are some people that are born leaders, but a lot of us have to learn things along the way. And I think just having a very short text that really kind of lays out in general terms what are the steps that you need to take in order to become an effective leader and build a strong team. So that's what the book is really about and why I put it together.
Well, I would recommend it. I would call it a great primer for somebody that was an aspiring leader, and also sort of a reference book for people that are in leadership positions. It's short, but it's to the point. It really could be a helpful tool to have around, I think. And I got it. I read it. I think it's great. So.
I
Um,
appreciate that. Anyone that's listening, it's available on Amazon. So if you want to get it, absolutely.
so who were your mentors and what did you learn from them?
Ooh, wow. That's how much time we got, Fred. So, I would say my first mentors were probably my older brothers. My oldest brother, the one that was Marine, Chuck, as we call him. His real name is Winston, but we call him Chuck. But Chuck, just watching him, and I'm the youngest of six, uh, watching my older brothers kind of navigate through life, and uh, I saw what they were doing, listened a lot, and still to this day, in my late 50s, I still listen to those guys. So I think that those three older brothers are my first mentors. Um, and then when I joined the military, there's there's a guy's name is Franco, um, and Franco was stationed with me when I was over in England, and he there it was a group of us that just in the military you got your cohort of folks that you hang around with. But Franco was he was like the big brother for all of us because he was older. He was a senior NCO, and um, he spent a lot of time just really kind of coaching us and just uh, helping us kind of because he was like that next step above us. Uh, in the military, I mean, I watched and aspired to be a lot like him. Um, and I think on the civilian side, there's several folks that I have um, that I've leaned on to help me navigate through my career. Too many to name, Fred, but I would say that anyone that's coming up in the ranks, make sure that you got someone or more than one mentor. When you reach the level that I've reached, give back and be a mentor for folks as well. So, um, but it's important to have someone that you can bounce ideas off of, um, that you're thinking about from a decision standpoint, from a leadership standpoint, from a career standpoint, someone within your industry and certainly someone outside of the industry as well. But 37 years, man, there's a lot of folks that I could name, but we don't have that kind of time.
No, and a lot of people say, well, I'm a self-made man or woman. None of
Nah,
us is. None of us is. We've all had mentors, and we've all had many mentors, and sometimes we don't even realize there are mentors until later we realize, geez, I learned that from what so and so taught me. And, I agree with you. Giving back is an important thing. Right now, you're the current chair of ARM, the Association of Healthcare um, Resource and Materials Management,
Mhm.
one of the most influential roles in the healthcare supply chain. How's your term gone for you, and what do you see the challenges and opportunities ahead for the industry?
I'm about midway through my year as chair, Fred. I would say that in large part it has gone very, very well. Um, and this ties to what I just spoke about in regards to giving back. And that's part of the reason why I have been as involved in ARM as I have been. I'm on the tail end of my career. I'm not ready to retire, but I know that I got less years left doing this than what I've already accomplished. So I start thinking about those that are coming behind me, and I think ARM, um, history of ARM, to me, it is the foundation of healthcare material. I mean, there's a lot of other organizations out there now, and I won't name them all, but I will say that any of them that are prominent, uh, they can probably say that they got the playbook to start from ARM. So I would say that our mission this year with ARM is really kind of to reimagine. We know what sets us apart from other like organizations is really our ability to kind of one reach those frontline team members that are in healthcare supply chain, not necessarily just the executive leaders, but getting down to managers and directors and the educational content that we have with on, I think sets us apart in that space. We've got local chapters that have linked into us and aligned with us on that methodology and that thought process. Um, and we also have what we call YPAC, the Young Professional Advisory Council. So we're intentionally leaning into those young up and coming supply chain leaders in our space to help kind of build the future. So I think that's what makes us a little bit different from the other like type organizations. Not and there's no shade at any of them because I think they all do great work, but you have to recognize that Arm's been around. And also our affiliation with the American Hospital Association really kind of sets us apart. We do it all, and I've enjoyed my term and look forward to continuing to help out with ARM.
Yeah, I just this week I interviewed Rachel Anderson and Ryan Burke, two of the YPAC folks that are there. And last year I went to one of the sessions where the YPAC folks were there with a bunch of us old people there at the same time, and it was really an interesting dynamic to number one. It's very uplifting to see the intelligence and the preparation that the young leaders have. And number two, it was great to see the long-term supply chain folks learning from the young folks during that presentation. So I think you guys are doing an excellent job. So what would you like to talk about that I missed, that I haven't asked?
Well, Fred, I think we talked about a lot. I think we touched on, I mean, obviously my background, my thought process as it relates to supply chain in our industry. Thanks for bringing up my book. I mean, I didn't write it necessarily for it to become a bestseller, but I wouldn't mind if it did. So I appreciate you, you putting it out there. And then ARM as well. I mean, that ARM, I've been involved in ARM for 15, 20 years, and it's just really important to me. If I had to, put my finger on what I want my legacy to be, I really want it to be about what did he give back? Who did he help get to the next level? Um, it would be a shame to take all of this experience and knowledge and not share it. And I've never been afraid to not be the smartest person in the room. So I'm always going to look to be around and work with folks that to bring something else, that I may not necessarily have to the table. So that part is fun, and I appreciate you opening up this opportunity for me to kind of just talk about our industry and not so much about me per se, but yeah, this is fun. I appreciate it.
Yeah, well, we appreciate having you here, Dennis. It's all the one thing that this series of podcasts is turning out, from my perspective, to be is an opportunity for folks out there to meet people that have been in the supply chain for a long time, that are sort of what I'd call lifers in healthcare. That
Mhm.
every one of them has one thing in common. We're not in it for the money, because you get rich other places. You don't get rich in healthcare. And it's great to see people like you, that is just you've applied yourself everywhere you've been. When I met you, I thought this guy's a real serious dude, right? Because I was trying to rag on you about the University of Florida versus the University of Miami, and I going, this guy does not like me. I got a problem here. But it turns out that you're just a guy that's focused, and I really appreciate your friendship. I appreciate you taking time to talk with us, and continued good luck as you make your way, buddy. Thanks for joining us.
Thanks a lot, Fred. Appreciate you.
Okay, buddy, have a great one. See ya.
You too. Bye
Bye.
bye.
Thanks again, everybody, for listening to our podcast, Taking the Supply Chain Pulse. Subscribe, follow, and give us your comments for topics or improvements. And if you know some people that you think we should be interviewing, please tell us about them too. I can be reached at fcrans, C-R-A-N-S, at stonge, STONGE.com. We'd love to hear from you. Thanks again. See you next time.